Serta. I'm a student nurse. I'm going to be talking about our research topic today, which is a decrease in nurse staffing can lead to a compromise in patient safety and the quality care of the patient, which led to our research question: does nurse staffing affect the quality of patient care? The purpose of this poster is to analyze and summarize research studies concerning the relationship of nurse staffing levels to patient outcomes and the adverse patient outcomes. We chose the 5 research publications, and we used the literature search engines Ovid, CINAHL, and SAGE. We narrowed the search down with publication dates of December 2007 to January of 2013, which were also peer-reviewed. I'm going to now introduce Jody, who is going to be talking about our focus a little bit further.
I'm Jody. The nurse staffing has been an ongoing concern for many years. This issue is one that influences the safety of both patients and nurses. The biggest problem with nurse staffing levels is that it leads to nurses being fatigued and overworked. Studies prove this can lead to an increase in injuries such as medication errors, an increase in infections, and an increased risk for falls for patients. Working longer shifts and overtime hours can also lead to nurse burnout and an increase in nurse turnover rates. Healthcare leaders also have an opportunity to create strategies and develop solutions that will build a safer nurse-patient environment. Amanda will now talk more about the significance to this problem.
Hi, I'm Amanda, and I'm going to be talking about the significance of the problem. The use of supplemental nurses can fill the vacancies caused by decreased nurse staffing. A better understanding of correct staffing levels can be obtained by knowledge through monitoring and staffing outcomes. Shifts must be adequately staffed with correct nurse-to-patient ratios, and nurses must be qualified, educated, and experienced. The relationship between nurse staffing levels and patient outcomes are associated with lower nurse staffing levels. Now Carolyn will be speaking to you about recommendations for practice.
My name is Carolyn, and I'm going to be going over the recommendations for practice. There must be standardized hours for each hospital in the country, in addition to realistic and appropriate nurse-to-patient ratios in order to deliver the most effective patient care. Nurses also should be advised to take regular breaks throughout the shift. Studies prove that breaks play an essential role for the productivity and well-being of the nurse and patient. Each shift must be adequately staffed with the right number and mix of staff qualifications. And in order to have adequate nurse staffing on each unit, changes need to be made at the management level. Nurse managers play a vital role in planning and enforcing staff breaks and providing staff to cover while the nurse is away from the unit. Now Dominique is going to wrap up the presentation and talk about the conclusion.
Hi, I'm Dominique. I'll be wrapping up with our conclusion here on patient safety versus our nurse staffing. Nurse staffing is obviously a very important key role in hospitals, and our patient outcomes, what they're receiving from nurses and staffing, if it's adequate enough, it is raising their potentials to get out of the hospitals quicker. Research articles are proving that RNs are working over 10-hour shifts. This is obviously leading to poor patient outcomes, which we do not want. Our 5 research studies have shown that there is an increased amount of evidence that insufficient nursing skill levels are increasing to nurse overload, tiredness, burnout. Most of them are dreading going to work. This is obviously leading to patients not receiving the best quality of care and support that our nurses should be giving them. Collaborative strategies should be coming into works for long-term solutions that will improve the quality of care that patients are receiving. in conclusion, the overall thing that we are hoping to see and change in nurse staffing is that we mandate the amount of hours that nurses are working to better improve the care that our patients should be receiving. Thank you for listening. That wraps up our whole presentation. We are looking forward to hearing your questions, comments, and any feedback you have in our discussions board. Thanks so much.